Yes. Hi and good evening. If you are seeing me for the first time, my name is Ophelia Bomar and I'm a clinical psychologist, and I'm here to tell you 5 lessons I have learned in my practice as a clinical psychologist, like lessons I have learned in the therapy room from my clients. Number one is I learned not to rush to fix my clients. Okay, there's always a feeling that because this client is suffering, is going through a whole lot of pain, I want to be able to elevate them from their suffering and pain. And so, back to back, you are just giving them homeworks, you are referring them to other professionals, as in, like, you feel that you are the savior. You kind of feel that you are the savior to liberate this person. All right, I realized that number one, I was putting pressure on myself. Number two, I am not my client's savior. Number three, I also understood that providing that client an emotional safety and a safe space was just enough for them at that moment. And people take time to actually understand what they are going through, and that is part of the learning process. It's not really about being results oriented, but more as in seeing the dynamics unfold in the person's life. Number two, I also learned that I should never actually confuse resistance to unwillingness. Why am I saying this? Because sometimes people are not ready, like I said, to face the guilt, the shame, the rejection, the trauma. It's more like reliving in the past, because that's what therapy would do to you. It will blot out all of the histories you have suppressed about you, that you were not proud about or you didn't even like about yourself. And so therapy will make you, like, bring all of that out and now start cueing these things into perspective, into an understanding that will now bring about the transformation. And so when people are not ready for this journey, they may be resisting, and that does not mean that they don't care about their well-being. And also, I understood that it wasn't about me being incompetent or unprofessional, because I used to think maybe I said something or I acted unprofessionally, or I might have said something that provoked them. But I realized, soon enough, that no, some people, when they are ready, they'll come for therapy. You don't have to call them and all the time trying to convince them to come for therapy. Number three, I also understood that my therapy relationship matters as much as the techniques that I used in therapy. Why am I saying this? Therapy techniques like CBT, family therapy, DBT, and all of those therapies used in enhancing the therapeutic relationship would be less effective if the client hasn't really got a relationship with you, the therapist. Why am I saying so? The client has to experience that you are trustworthy, and that you are empathetic, and that you are non-judgmental. And we have our code of ethics that says we should be empathetic, we should not cause harm, be benevolent, and all. Like, the client has to experience you as being that, because your everything actually tells clients whether they can trust you or not. And some may test you quite a few times before they can open up and tell me what is a successful therapy without safety or confidentiality. And so I realized that no, I shouldn't have to be a clean slate like a lot of professionals, mental health professionals are, but rather I should build rapport. So I understood early on that my rapport building skills was very important, and that could lead to the results that the client and I both wanted. Number four, I learned to listen to what was not said. Okay, what was not said, as in the nonverbal cues, the silent smirks, the eyebrows and the coiled, hands, or how they cross their legs. or even the tone, the voice, the volume, the pitch. All of these things actually meant a whole lot about how they wanted to express themselves in therapy, and the things they were talking about, what it meant if they pressed on such subjects, meant that these were areas that needed to be worked on. And so I had to do a lot of the learning with what they did not say, and I was very careful not to bring up subjects they were not ready for. Number five, I realized that my presence is part of the intervention, because I've written them down. My presence is part of the intervention for these clients. Why? The way I sit, the way I talk to them, the way I approach things, my voice, how professional I am, how competent I am in subjects that I know. And, it's a whole lot about you, the client, rather than it's a whole lot about you, the therapist, rather than the client, because you are the one providing the service. And so you should be an expert, or you should have some good knowledge and insight and experiences with what you're offering, right? And so if I am the representation of what I'm offering and I am not meeting up standards, it's what does it tell of me, you see? And for a bonus, I would like to share that a lot of times your clients may present stories that will conflict with your biases. Yes, my first year was a huge conflict with the clients I was meeting, with with my beliefs, with my manners, my norms, my religion, my tradition, and like everything was just a conflict. Things with my hard hard on opinions, and then ideas, and all of these things will come to play. So you should understand that sometimes counter transference will come in. Like, you may meet a client who will just love you, especially the opposite, the males. Yeah, there are some who, because you're beautiful, you have all what they want in a woman. And so when you meet clients who are not married, would somehow not know, but they may fall within the counter transference category. And it is my duty to make sure that I don't shame them, because they truly do not know what's going on. And so I have to explain to them that, you see, because I'm providing you these services and I look nearly perfect and I'm beautiful and I am well articulated, you may fall in love with me, you may like me because I'm wearing the savior coat. I am opening up my arms to receive you, which you are not likely to have out there. But you should know that this is mainly work. We are trained to offer and soothe your pain and help you understand and elevate and transform. So you don't shame them, as in like, why do you like me, and da 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 da. So what I actually do was to refuse gifts. It is even taught in training school to not receive gifts from clients, except you are very well informed, or well aware that this gift is truly genuine. If not, we were actually advised not to receive any gift from our clients, especially when it is the opposite sex. It can create some misunderstandings and all of that. And so this is just a few things that I think I can share with you. And lastly, boundaries. If you're a young mental health professional, your boundaries has to be strict. I'm saying this because if your boundaries are porous or loose, you will have people calling you at the wrong time, sending you wrong messages and signals, and communicating to you in ways you do not like. And so they may confuse the attention and the care and the compassion for something else. And so your boundaries have to be strict. So yes, I can be very sweet in the therapy room, and I can be very stern outside of the therapy room. And this is because I don't want to lose my license I always do what we call referral. If I see that there is some misunderstanding, I just refer you. So thank you for watching me. If you have any question, please feel free to type in my comment section. Bye.